management, and how important is it not to have to rely on pills? Now, even if, let's say, pills are helping, let's say a person takes pills, they feel better. I'm going to give you a case scenario. Now, this is something that happened just quite recently, and I may have announced this uh, or I mentioned this on the previous in a previous show's broadcast. But when I was in March, when I had my surgery, I'm wearing a belt right now after I overdid the exercise this morning. But uh, so when I was in the hospital bed, just awaiting surgery, it was almost 6 hours, 16 hours actually, before they could take me in. So I was in this hospital bed, and I couldn't move. I was pretty much nearly paralyzed, and there was unstable third level of lumbar spine fracture, not just fracture but burst. There was nothing there left to protect the spine. The terrible situation, terrible. And what I found out is, even though I came in, transferred from my friendly hospital to this big hospital as a physician who should be treated well, so to speak, I ended up in bed calling for attention for 7 hours minimum before anybody responded. So now that included several things. And by the way, I'll make a statement here. I learned a couple of things. So while swimming in my own pile of bodily fluids that I couldn't actually even move because I couldn't move, and calling for help, nobody came. Well, I learned that the current healthcare system, it just reassured me, is just the same way, full of crap. Number two, I think I can say that on the radio without getting into trouble, right? Okay. Certain things we will not be able to say, but certain things we can.
And that's putting it mild.
Very mild. Second thing I learned very powerfully is that if the worst comes to worst and there's no pain pills or no treatment available, how do you deal with severe pain? At that point, I would say I was about 9.5 out of 10. I haven't seen 10 yet. I'll see it at some point. And all I could do, the only thing I could think of is biogenics, because that's the one thing I can control with my mind. And I kept running through for entire 7 hours. I think I went through the entire library of our exercises related to. And by the time the nurse came to give me that pain pill that was 7 hours later, I just said, you know what? Too late. I'm good now. Don't need it. I mean, I wasn't good, but
you were good enough.
I was good enough. And I was actually quite frustrated as well at the time. But please.
Well, interestingly, again, Gary Null said the reason they call it number 3 is they ignore the fact that they sign up people who are dying the disease and not the complications that the treatments caused. Every known drug, including aspirin and everything else over the counter, chronically causes problems.
Mm-hmm.
I mean, I was taught in medical school over 65 years ago that 13,000 people died from aspirin every year.
Mm-hmm.
And, it's okay to take an aspirin occasionally, but if you take it chronically, you may bleed to death or at least develop lymphocytic colitis or collagenous colitis. They're both bad. And there is no chronic disease for which the drug does not create problems. In fact, the number one cause of high blood pressure in this country is anti-anxiety drugs. More people develop hypertension from taking anti-anxiety drugs than they do from anything natural. So it's okay to do acute medicine, but if you want to live and thrive and be healthy and survive, you get holistic medicine. It's that simple.
Absolutely, perfectly well said. Let's talk about pain, holistic pain, as the foundation for it all, because your journey began
with pain.
With pain,
not of mine, of what I saw happening between, mostly 1958 and 1963. I didn't throw up in the operating room, but I came close. We were taking a razor blade and breaking it off in a little pair of pliers and cutting the front half of the spinal cord for chronic pain. I mean, it's the most barbarian procedure I know of in modern times. And I was so appalled by it that I spent 3 years doing research on pain physiology. and I came up with 2 procedures which now are used still all over the world: spinal cord stimulation and TENS, or transcatheter electrical nerve stimulation. That was the beginning of my transformation from conventional neurosurgery to holism.
Now, I'm just going to jump in here, real brief. When you talk about procedures and barbaric procedures, now, some of it has gotten better to some degree, but how many unnecessary surgeries, especially spine and back,
Well, that's
are
the
being
other
performed?
thing. My average patient back in the late 60s to early 70s had 5 to 7 unsuccessful back operations.
Precisely.
Now, if the first one doesn't work, it's like the first marriage. If you get married a second time, you still have a significant chance of not making it again. And, well, in my opinion, it is okay to operate on the back once if the nerve is actually being damaged.
Compressed.
But
Yep.
if you're doing it just for pain, you're going to be worse. 50% of people, just after a simple laminectomy, still have chronic pain. And it is no better today than it was then. And then they put you on Percodan and Valium back in those days, and they're 2 of the worst drugs in the world.
And actually, now
I wouldn't give them to a sick dog.
Well, at this point, there's so many narcotic medications that are basically prescribed all over the place. And I'm guilty myself in the emergency room, especially when somebody comes in with an injury. But there's a difference between an injury and acute versus chronic. And we do our best to not have people on chronic. When they come in on that, for example, we will support them, but we'll see if we can get them off of that. And there are many safe, holistic, and natural ways to accomplish that without resorting to drugs and surgery. Shall we focus on some of that?
Well, interestingly, by the way, the American medical system rejected acupuncture for 100 years.
Yeah.
And in 1971, I gave a major lecture on electroacupuncture. And now acupuncture is at least allowed and accepted all over the country. Acupuncture has been around for at least 4,000 years. It's a wonderful technique. And electroacupuncture, which I introduced, is even better than acupuncture itself. The first visitors to this country at the Nixon thaw were to my clinic to learn about electroacupuncture.
Mm-hmm.
And so safe electrical current is one of the greatest foundations for holistic medicine. But in addition to that, you need to train the brain.
Absolutely.
That is the most important of all. Train the brain. It should be started when kids are in kindergarten.
Actually, for the purpose of completeness, let me just take two steps back, I should say. There's 2 steps here. Number 1, let's go back to the foundation. What makes a holistic perspective, or in other words, holistic approach to pain? Number 1, first and foremost, now we're talking about chronic pain. I want to make a specific clarity, I should say, on the fact that what we're talking about is not the acute pain of a heart attack or a broken bone. You have to be seen and checked out properly, whether it's urgent care or emergency room if it's more serious. And not knowing where the pain is coming from is not safe. Again, if you haven't been checked out and something is getting worse or not going away, that's a body signal to saying, hey, pay attention, something needs to be addressed. Now, if it's been addressed and there's nothing dangerous or no red flags, perhaps, and it turns into a chronic situation, which is 6 weeks or more. Now, technically, it's
6 months, which is ridiculous.
Which is ridiculous because by then already you have terrible patterns.
Like to be alive.
Right, exactly. So the idea here is how do you start with a foundation once you know that you're not going to die from this acutely? You got to have lifestyle. Then the next big category is proper supplementation. We'll mention a few things. Another big category on pain management is training the mind and the brain on how you process brain and how you respond to it. Again, that's how I was able to get through that hospital first night. And that was a wonderful experience on one hand, because I just realized the full power of that.
Well, interestingly, in 1977, I was able to undergo a very major surgical operation on my nose, under the nose, through the bone at the base of the skull, with no anesthesia because my brain was trained. And I said to the anesthesiologist, give me 20 minutes, I'll be ready. Now, I could hear the noise when they crunched the bone, but no pain. So once the brain is trained, you can even do lots of things in acute situations which you couldn't do otherwise.
Absolutely. And just a brief mention, because we don't have, we have only a certain amount of time to talk about everything, but we've talked about lifestyle before. And what we mean by lifestyle, holistic lifestyle, must include proper nutrition. There's a lot more detail to all of this. Exercise and activity as able. As able. In other words, if you're not able to do one thing, do something else that you can do. Move. Get your body going.
Even if you can't move,
Mhm.
I believe the AccuMassage device
Can help.
is excellent. It
Yeah.
it stimulates the lymph flow better than exercise does.
Yeah, but most people who are not completely paralyzed from the neck down, we should be able to do something. And that's important because you don't use the body, you lose the body or the function. Third thing is sleep, and sleep and pain are intimately connected. So when we talk about taking care of pain, of course, we're talking about helping have better sleep. Stress is a huge factor. We'll get to that in just a second, because stress is in a category of its own. And that's where, Dr. Selye has demonstrated in 30s and 40s, and going back, even other people have said even better. But stress is behind over 90% of all the bad things, including chronic pain.
And that stress can be psychological, emotional, spiritual.
Yes.
It can be physical, it can be chemical. However, the most common major stress is psychological anxiety.
And what I love about what you outlined in your PhD thesis, which is now currently the basis for the biogenics, so the retraining program, starting with autogenic training, which is a way to kind of just literally calm and center yourself, and then you can take it further with other exercises, which is what helped me, saved me in that night.
I would like to make our first big offer
Yeah.
of the golden anniversary. If you hear this today and you want a copy of autogenic training, I will give it to you free of charge. You can buy the biogenics program now or later, but if you want it for free, just send an email to Norm at Norm Shealy, send me autogenics.
Actually, there's a better way to make sure to collect everybody's information who is interested. I talked to Matt. He gave me a pathway. So
we've got just to get autogenic training?
no, but better than this, just to get all sorts of goodies.
Oh.
In the Facebook and YouTube section, just leave us a comment. Leave us a comment or allow your contact information. And there's going to be I want to make sure I say this right. In light of the 50-year backstory, history of background of everything wonderful, amazing that's taking place, this year is going to be full of surprises. And every week we're going to announce something really, really wonderful, just so you know. But over this week, that were 7 days, entire course collection, including pain management, biogenics, which is complete self-regulation, life beyond 100, personal intuition. Every course that we have will become available to a grand prize winner. And that's a tremendous value with all the courses.
Oh, yeah, all the courses.
But so that's
and how are they going to get the grand prize?
This is what I'm told. Not my strength here, but if a person goes to the comment section, leave your contact, leave your information where we can get in touch, there will be a winner selected for that. And by the way, Matt has announced that we have a lot more coming down the pipeline.
Of course.
So next week is going to be an announcement, and the following week might be a real special announcement. So keep watching, and this is the 50th year anniversary of holism. It's got to be worth something.
Well, we got a golden anniversary.
That's right.
It's worth the gold.
It's worth the gold. Yes.
And the gold is worth having.
Exactly.
I get comments from people all the time about how much they've learned and how good it is and how much better they are from using the biogenics program alone.
Now, beyond the biogenics, so let's outline the steps or the approach to the holistic pain management. So first of all, we talked about lifestyle. Second of all, you got to have good and proper stress management, and how you process the pain coming in and how we process output. back into the body. There are several things that I've noticed with many clients, and there are certain patterns. If to me, simply speaking, pain is a sensor. Everything is a sensor. The stable is a sensor. That means I shouldn't go any further than this. If I get a spasm or something telling me not to do certain motion after my surgery, I won't do that motion, but I'll do other things that I can do. So it doesn't, to me, I don't get emotionally attached to the pain. Even if it's terrible, it's just, okay, here's a sensor. But so is everything else. Feelings and emotions are sensors. Checking in. Because here's the bottom line, folks. Becoming self-aware and becoming aware of what are the triggers, what is causing the pain, what's contributing to the pain, stopping the behaviors that are directly contributing to it, and changing those things that need to be changed. And that's only a holistic provider can do.
Well, let's talk about what holism really means.
Yes.
It means holy,
Yes.
and that means spiritual. And although we have unbelievable numbers of things going on, nothing is more important than your spiritual attitude and belief system and life. Because you are really here as a temporary period. No matter how long you live, it's temporary. But you are eternal. Your soul lives on. And that's the real difference between conventional medicine and holism, is the soul and the spirit.
That's exactly how I work with clients, and that's exactly why we have, well, over 35,000 successful outcomes now.
Yes.
And I believe the ratio was about 85% success rate, where everything else has failed.
And most of the time, the 15% who aren't successful won't do the work.
Exactly. So I ask immediately when I do a consultation, are you willing to do this? Are you willing to change your lifestyle? And I mark it. And if a person is honest, at least I know where the limitation is going to be.
And I want to give you one example.
Mm-hmm.
There was a man who was a workers' comp case referred by the workers' comp carrier, and I worked with him for 2 full weeks, and he was fine at the end of the 2 weeks. And I gave him a program to do at home, and 6 months later, he told them he was no better. And it turned out he hadn't done a thing he learned in the 2 weeks, not one. So I said, settle his case. He's hopeless, because I can't think for you. I can't eat for you, but I certainly can't be spiritual for you.
Mm-hmm.
And you are responsible for everything that you do. So at the top of the list, perhaps other than being aware of your spirit and your soul, is nutrition. Remember, the number one cause of premature death in this country today is listed as obesity. The number one cause of premature death. 36% of Americans are obese. That means 40 pounds or more over your ideal weight. Now, even if you're 10 pounds over your ideal weight, you're at increased risk. But by the time you get to 40 pounds or 100 pounds over, you're on death's row practically. You may stay there for a while, but you ain't going to be here long enough. Next is, most food in the grocery store is junk. In the center aisles, don't buy. It's junk. If it's in a plastic container, if it's in a box or cardboard, don't buy it. It's junk.
And the other thing that Dr. Shealy is saying, and by the way, there's a reason why I stepped away for a sec. I wanted to introduce one of the best devices for pain management, but also mood and otherwise. But no, I'm sorry, continue. Go ahead, please.
Well, I mean, again,
Yeah.
fast food restaurants suck.
Yeah.
I wouldn't give you 2 cents for all of them combined. And of course, 22% of adults still smoke.
All inflammation, bad food. Yeah. I think we're going into a break. Okay, we're going to
continue on Facebook.
Yeah, and we'll come back after the break. And with questions.
That was a spiritual interlude.
I guess just go with the flow, right?
Yeah. At any rate, you might as well look and see if there are any questions today. But the important thing, folks, is you are responsible for your health habits. Do take care of yourselves. That is different these days.
But you know what hasn't changed? Our appetite. People still need to eat, and some of it.
Sorry.
Okay.
That was so loud.
It's okay. Let's go to the questions. See what or comments.
Just happy anniversary wishes. That's all we've got.
Oh, wonderful.
Happy anniversary. Dr. Shealy is a very gifted human.
Yes, yes,
Um,
yes, indeed.
And I'm sure Dr. Sorin is exceptional as well. Happy anniversary. Just all happy anniversary wishes.
Well,
Oh,
thank you, folks.
That's all we've got.
Stay with us so we can talk about what's most important.
but let's talk about one of the most powerful devices, or one of the techniques that we use for chronic pain.
Well, I have, many, many inventions and discoveries and 16 patents, but this is my favorite.
Yeah.
Because this, in my opinion, is more important and more successful and more useful than all the psychiatrists and drugs in the world. For depression, for anxiety, this is the optimal thing to do. There's not a drug that can come close to competing with it. That's a little bit more comfortable if you put it on your head with the wire running away from your head,
Yep.
down the back, and then you turn it on, and I just turned it on, and now it is giving him a frequency from 5.83 to 56.81 cycles per second. Every 10 minutes, it goes through that entire frequency. And his brain, as long as it's on his head, is an optimal gamma frequency. Gamma is in the zone. Who cares? Free, at peace. And even if you've got it on your back or buttocks, your head will still get some gamma, not quite as much. Now you can turn this one more frequency, red light comes on, now you're getting only gamma frequency. It's still better than having it on your head, because you will always get a gamma frequency when it's on your head. But then if you turn it one more down, you're into delta, and that can put you to sleep. So we'll get out of that quickly.
I guess you don't want to hear me snoring on the radio, right?
And delta is okay if you want to use it for that. But the most important thing is putting your brain into gamma. First discovered in Buddhist monks who meditate 8 hours a day. In almost 8 seconds, you're in gamma when you've got this on your head. It cures opioid addiction. Infinitely better than anything that's ever been discovered. Our gamma opioid addicts are now approaching 5 years free.
Now, you know what the average rate of success in the addiction centers are? 17%?
17%.
Yeah.
They get to treat you at least 5 times, and they can't do as well as we do in one time. It's that simple. They're not interested in the gamma because they lose money. They don't get to treat you 5 times. And this is cheaper than a week in their facility as well. So, the interesting thing is, well, this is part of holism. To me, this is the crown jewel of holism.
Speaking of a crown, right? Or a halo. Yeah.
Yes.
That's,
But there are others. Even our regular TENS unit, the first one of my first 2 discoveries, is still exquisitely useful for chronic pain. Often, I had a patient just yesterday with a pain of 7 out of 10. That's pretty significant pain. Within 10 minutes, it was down to 3.
Mm-hmm.
By the time of the end of the day, she's going to be down to 0. That's quite common. And that's just using a simple, old-fashioned TENS unit.
And that's wonderful, but that's the power of having options. Because here's the thing, most people, and coming from the emergency room setting, I did the weekend just before near St. Louis, it's interesting how most people who are chronic pain sufferers don't even know that there's options.
Well, that's true.
We'll get ready to come back in about 30 seconds.
Mhm.
Okay, we'll be back on...
About 30 seconds.
About 30 seconds
and
coming
then
back
we'll be
into
open for
the radio.
questions after that as well.
Yep.
Okay, so the important thing, folks, is, are you interested in being optimally healthy? Now, I also am interested in healthy longevity. Both of these are critically important to me. And, the important thing is think. Think
Back
health.
to Wellness Wednesday with Dr. Norm Shealy and Dr. Sergey Sorin.
And we're back with you. And now we can take your questions about anything, because it's all related to your health. 417-447-1777. And we'll put it on the air. Oh, you're on the air.
Hi, can you hear us?
Hello?
Yes.
Yes, what's up?
Well, friend Bob Mundy,
Oh,
the
Bob.
greatest doctor
How are you?
in America that has the answer and are miracle workers, in my humble opinion.
Thank you. Thank you. Thank
Hey,
you.
I do have two quick questions. For some reason, my index finger on my right hand has gotten infected at the first joint
Mm-hmm.
and it's swollen maybe near double, so it has pain.
Gotcha.
I did put a little bit of hydrogen peroxide along with ascorbic acid on it, and it started bringing infection through the deal. I didn't bust it open. Number one, should I go ahead and pin and pop the infection? And what should I soak it in? What should I do? Because
let me describe the procedure, standard procedure in the emergency room, and you can actually read between the lines. That's pretty much with most of the things we say or on the show, but on certain topics, the thing that I would do in the ER is I would certainly find an area of most fluctuance, soft part. I would cut it open so that not a huge incision, but just enough to make the stuff come out, get as much of it out, and I would get on antibiotics, and that's.
And again, I was going to say at the top of the list, there is where antibiotics are really important in an acute infection.
Yes.
Now, at the very least, if you're not going to do this, go in and get your antibiotic shot or oral. At least put triple antibiotic ointment on it instead of peroxide.
Well, peroxide is actually, it's not the best solution in that respect, but it certainly can be somewhat helpful in cleaning out and preventing further.
Okay.
Yeah.
Okay. The other quick question. Thank you, men, for standing up for truth and being there for hurting America right now.
Yes, sir.
As far as the jab goes, and I know it's not something very much to talk about, but as far as D3, vitamin C, and let's see, there's another one there. These type of things, can they help our immune systems to fight? To where it won't penetrate our system.
Yes.
Yes, I would take 150,000 units 3 days in a row.
If somebody gets sick, but let's talk about the supplements right now that will strengthen the immune system against any kind of viruses and bugs and things of that nature. We're going to start off with a couple of basics. You got to have a good B complex anytime you have vitamin C. So 25 milligrams of essentials. It's a Dr. Shealy-Sorin.
And by the way, if you're acutely ill, I would go up to 4 or 6 a day instead of 2 a day.
Yeah, B complex, absolutely. Yeah. And then you got to take a good vitamin C. Now, by mouth is essential, but also intravenous is one of the keys. That's on top of everything else, and that's what kept me out of the hospital with a certain viral illness. I would have been hospitalized. I wasn't, and I did fine. Intravenous vitamin C, again, something really great for the immune system and antiviral. So another thing is vitamin D3. This is 50,000 units if a person gets sick on each, day 1, day 2, day 3, so 9 capsules total. And then you go back to either once a week or once every 10 days, depending on the weight. Then there is something called beta-glucan. Beta-glucan is present in the youth formula, and it's an immune system enhancer. And 500 milligrams, so they come in 250 milligram capsules, so 2 of those per day. And I would also throw in, if you can get a medicinal mushroom extract. You can either like 7 mushrooms or 3 mushrooms, but there's a number of them that support the immune system, and that's another.
Rhodiola is one of my favorites. Lion's mane,
zinc,
and tiger's tail.
That's right.
Yeah. So the zinc is very important also amongst that.
Yep, 30 to 50 milligrams general. That's a good amount.
Excellent.
Yeah.
Well, thank you, and may God continue to bless you all as you're standing up for truth.
Thank you, Bob. Sir. Take care of that finger.
Wouldn't have it any other way, sir.
Man, I'm going to today. Bye.
Take care.
Have a good one.
Yeah.
And now is your turn. 417-447-1777. Don't be bashful. Ask a question about anything.
Yes, absolutely. So let's continue our conversation about holistic approach to pain. Holistic approach to pain does not mean doing the same thing over and over again and expecting a different result. That's not holistic. And doing that would be an example of repeated surgeries or having to take drugs on a regular basis over and over again. Holistic pain management means you start from the spiritual mind and body perspective, and people don't understand the concept of spirit mind body when it comes to health because it's been dissected, it's been butchered, it's been isolated starting almost 300 years ago.
300 years ago,
Yeah.
roughly, the soul was kicked out of medicine. And that's why we put it back in.
We have to, because what is a human being? Now that goes back to one of our favorite meditations, and also biogenics exercise happens to be. Who am I? I have a physical body. In other words, I have this physical body, and I am more than my physical body. So if I have a pain or problem or an issue or something is going good, great, or terrible in that way, but I am more than that. I can overcome that. I have thoughts, feelings, and emotions, and not all the time we're feeling happy and you know, well, shiny and beautiful. Sometimes we feel terrible, including depressed, anxious, and those things actually go extremely commonly with chronic pain. So treating pain and depression, you have to do both at the same time. And there's again safe and effective modalities without resorting to drugs or surgery. And then, of course, realizing that all these things, mental states, anger, frustration, depression, we are more than that. We have mental states, and we are more than that. We're spiritual beings. We come into this experience, and therefore we're able to change the patterns if we choose to. But there's only one person for any given human out there that can do that for them, and that's themselves. I can only work on myself. My wife cannot help me. My medical partner cannot help me. He helps me in many ways. A million of ways.
But if you don't help yourself, I can't.
If I choose not to take care of myself, nothing he can do, and vice versa. So the bottom line is realize who you are. You're an essentially free spirit. I'll say this again, free spirit. And I love the word freedom, and I love the word spirit, because then it opens up all sorts of possibilities. You take away fear, you take away limitations, and then you just look at the world and it's as it is. Objectively and with all options on board. And the only way you can do that is by working through holistic mind, body, spirit, eliminating physical blocks, including those that cause pain, including dealing with mental and emotional, getting to a place of clarity and just being your best self. That's all there is to it.
And again, one of my favorites is every thought is a prayer.
Is a prayer.
Thinking sets in motion spiritual forces to bring about change. Good afternoon. You're on the air.
Yes, I was wondering, you spoke about this in another show, and I just didn't catch it. It was about the
progesterone.
Yes.
Yes. Okay, after menopause, do you continue
after menopause?
that
Go ahead.
as a
Did we lose you?
female?
Oh, yes, actually.
Oh,
Okay.
I'm sorry. I disconnected my mic. We didn't lose you.
Okay.
Yeah.
Okay, yes. In my opinion, that is one of the prime reasons to consider using eugesterone, the best of progesterones. Eugesterone, yes.
Okay, and that's what you have.
That is what is in our preparation. Yes.
Okay, in the cream.
Mm-hmm.
And men can use it too because it raises your DHEA, the anti-stress hormone.
Yep, and it's on the website.
That was my next question.
Yep. Look for the package of DHEA package. Also on realholisticdoc.com. There's 4 things that raise DHEA by overall 250%. It's wonderful.
Okay, would you repeat that one more time? Real Holistic?
www.realholistic.com.
Okay, doc.
And for the clinic,
.com.
if there's an interest, because we also do carry some products there, it's actually, I have the telephone number, 417-351-5221.
But if they want to buy the
Wonderful.
products, they should
Probably
call.
to talk to, yeah.
That would be 417-467-3351. That's the store
Sounds
number.
about right. Yeah.
Great. Okay. Well, I already have the product because I started taking it a long time ago, and I read Dr. I think it was John Lee, who I know is not around anymore, but he spoke about this product, and then I think it's very similar to what Dr. Shealy, his product is at this point. And then, so I took that for quite a while, but now I'm way past the menopause, and you mentioned it last week.
Absolutely. Yeah.
Okay.
And
Okay, and
correctly.
on this website, it will tell me how much for myself as well as my husband.
1 pump a day.
Each of us?
1 pump a day.
Yep, for each
It's
person.
a certain amount of cream.
For each person.
Yes.
Okay.
Absolutely.
Wonderful. Thank you, and happy anniversary.
Hey,
Thank you.
happy eugesterone.
Happy eugesterone.
Thank you. Thank you.
Happy
Have a
holism.
blessed day.
Yeah.
Blessings.
Actually, I'd like to say that this is actually more than just a celebration of our practice, the celebration of the revival of holism. And that's a big deal.
Of course.
That's a huge deal.
Well,
Yeah.
you know, the deal is for optimal health. Physically, mentally, emotionally, and spiritually. All of them are critically and equally important. And again, you are the only one who can do it. We can talk all day, but if you don't do anything, we can't help you.
That is.
I can't breathe for you, let alone do all the other things that are necessary.
Comes back to the same concept: personal choice and responsibility. You know, we talked about this before. I want to say this again. What does responsibility means? What does that word mean?
It
Response able to respond and obliged to respond properly in your best capacity.
And you just mentioned one of the most important reportings. Being responsible is conscientious.
Yes.
Conscientious people live longer and make more money throughout their lives than people who are not conscientious. And conscientious means being organized and responsible. It's that simple. It doesn't take anything big to do it. It is the single most important thing. A wonderful book came out in April, I think, 18th, 2011.
Wanted to jump in with a couple of practical suggestions since we have a little airtime. So what are some of the other things that people should take or should consider, or as a package, or in general for helping their chronic pain? Now, assuming, and that's a big assume, is that the cause of the pain has been figured out and there is no red flags.
Well, we have a new one coming out. It's not quite out yet, but we have Pain Relief Bliss.
We do.
And if you have local pain, not with an infection, of course, but just local muscle aching pain, we are finding Pain Relief Bliss to be excellent. It's safe and effective and a heck of a lot less expensive and safer than any drug in the world.
Indeed.
And it's easier than a heating pad, which can work, or ice packs, which can work, but they're not as comfortable.
Is that already on the website?
It's not on the website yet.
It's coming.
It's coming.
Okay.
It'll be here, hopefully, by the time of our anniversary at least.
You know, I remember
we just approved it this week.
Oh, that's awesome. I remember the first time I tried it on myself, I asked, how soon can we get this to, out there? But this is wonderful. So,
and good afternoon. You are on the air.
Hello.
Hello.
Yes.
No, this is Mark.
Hi.
Hi, your Franciscan brother, Mark. Sergey.
Mark.
It's wonderful to hear you both.
It's been too long. How are you?
It's been too long. I miss you both. And I have a quick question about one of your recommendations, or what would you recommend for asthma?
Asthma. Okay, first of all, let's talk about the immune system, because asthma is a primarily a disorder of the immune system. Now, I'm not against having a rescue inhalers, because if the bronchospasm happen and you cannot breathe, obviously anything goes. This is where I'm even open to inhaled steroids, and even sometimes oral steroids if somebody is going into a life-threatening situation. But the bottom line is, if you can avoid it and prevent it, and Mark, this is where I would absolutely optimize everything with a lifestyle, because immune system, most of it is lifestyle. If we take care of ourselves, we'll be for the most part be okay. Stress management, but again, you're pretty good with that, for generally autogenic training or some kind of a technique or a way that you can get yourself in a better balanced place. But supplement wise, that you really should be on the minimum is, and I believe, I think, let's summarize briefly. A good B complex or essentials, youth formula, vitamin C, absolutely essential. In this case,
and
also
D3, of course.
D3, but also K2, extra K2, because K2 works with D3. And then, of course, I would also throw in astaxanthin, and I think we're going to have to spell this one out.
ASTAXANTHIN, 30 milligrams a day.
Yes. And then last but not least, beta glucan, 500 milligrams or 2 capsules. And there is a product called Autoimmune X as well. Now that's a different website. I'm just going to say this, so you're not going to find it on our website, but it is a wonderful company called on lifesavingformulas.com, but that's a long term, about 3 to 12 months when you start to see things happen. But it's a wonderful product as well. Bottom line is, keep your immune system, keep yourself healthy.
And in my opinion, also, if you've got to respond even with steroids, that's when I would like to use IV ozone and IV vitamin C.
Absolutely.
To me, that's the peak major holistic thing to offer for the immune enhancement of everything.
Oh, those things. And Mark, remind me, where you live, do you have a holistic provider, intravenous vitamin C on Myers or ozone?
No, we're back in Colorado.
Okay.
So not too far from you, but but this would be for not me, but for
understood. Gotcha. If a person lives near a holistic center such as ours in Springfield, Missouri, I would get a booster, especially in this season, anywhere between weekly and at least once a month. And there's right now packages going on special until the end of October. And the code is, by the way, this radio station name, KICK, K-I-C-K, 92.3 IV. And that's office 417-351-5221. Very important for the immune system. We have a caller? Yes. I'm sorry. Sorry, I got carried away there.
Okay.
Yeah, Mark, thank you, brother. Yeah.
Good afternoon. You're on the air.
Yeah, a couple weeks ago you mentioned something that people can take that has dementia, and they take blood thinners. Can I write that down that you recommended?
Nattokinase, Nattokinase.
Natto
Kinase.
Kinase. And then do you have to get that at a supplement store?
You get it at a health food store, yes.
Okay. Oh, that's awesome. And then it's pretty, I mean, that's the best thing you recommend for people with dementia.
Well, in general, actually, my top recommendation is the Gamma Pimp device.
Oh, it's a device, Gamma
PEMF.
Yeah, let me demonstrate.
I had a man walk in who was so advanced that he could not speak or walk. In 1 month, he walked into the clinic.
Wow.
I had another woman who was at the beginning. She couldn't tell you the time of day. And again, within 1 month, she was perfectly normal because she didn't have that bad a disease. So there's nothing better for dementia. Now, you got to have the basic vitamins we've already talked about. But the Gamma Pimp device, which, personally, well, in my opinion, the most important invention of my life.
And one of the easiest ways for people, especially if there's behavioral or difficult situations, you can even tape it to a headboard or somewhere where they're near, and just let that be the case.
So the device, they put it on their body? Is that what that is?
Yeah, just like so.
Oh, okay. Awesome, then. I appreciate it. Thank you for your help.
Yeah, you bet.
All right, bye-bye.
Bye.
Thank you. And we've got time for one more call, 417-447-1777, or we will continue talking about your health.
And the number one, well, here we're talking about holistic pain management. So let's just give a quick essential summary of what holistic pain management is about.
Well, obviously, it's attitude and training the brain and using one of. Oh, we've got another call, so let's finish that later. Good afternoon. You're on the air.
Hi.
Wonderful. Okay, would you repeat that one more time? Real holistic. Hello.
Real holistic with an H.
Hello.
Yeah. Hello. Can we hear you?
I hear two voices.
Hi. I think it was the radio maybe in the background.
Okay.
How are you? Can you hear us?
Oh, I am. Okay, I'm on the air. Yes.
Now we're good.
And okay. I have biogenics.
Mhm.
I have a PEMF.
Biogenics,
Wonderful.
PEMF, yes. Uh-huh.
And I also have a TENS unit that's not from you. It just was something that I've got access to from someone else.
That's okay.
I have leg ulcer pain, and I'm wondering, obviously biogenics is wonderful.
Mm-hmm.
And I'm wondering whether it's better to put the PEMF on my head or whether it's better to put it on my foot.
I would put it on your hip, but I would also use that TENS unit on your ankle. Put the electrodes on either side of the Achilles tendon, right there at the ankle, because for leg pain especially, the TENS is still excellent. But I would put the PEMF as close to it as possible.
And, and the PEMF, especially if you can, get it closer to the wound, will certainly help with the healing.
Okay, but it's also good for other things to have it on the head, I guess.
Minimum 2 hour minimum on the head is absolutely wonderful. I should say minimum. Anything you do there is great. 1 second is great. But we've seen great results in research with 2 hours. That's how we call it that. Yeah.
Wonderful. Thank you very much.
Hey, thank you for calling. Have a good one. And so, keep the faith, babes.
Yeah. Holistic pain management, mind, body, spirit. Actually, we still got about a minute to finish up the radio show. So I just want to say I am honored. I really am honored to be sitting here with a man who started the concept and the movement of the holistic pain management. And Dr. Shealy, it is an honor to have you with us.
Well, my brother, and that is our relationship at a soul level. I interviewed 100 physicians that I turned down. You are the exception.
Thank you.
You've got common sense and oomph. And that's what it takes. You've got to, you got to enjoy and be interested in what you're doing.
Dr. Shealy, you're 100% correct. I can summarize my entire professional purpose in one word: holism.
And you can enhance your health if you adopt and practice the holistic spiritual approach. That is the key thing. Good health habits, good spirit, and until next week, y'all have a good one.
But before we go, we'll take a few questions or whatever other comments are available.
Okay.
Questions.
We have one question on the internet. It says, I have been diagnosed with spondylosis.
So, question on diagnosis of spondylosis.
Is this going to be a life process? I do yoga and self-massage. Will I always have this, or can it be cured?
IDD. There's a product, one of my early inventions a number of years ago is a specific kind of specialized traction. Interesting, the medical profession never took it up, but it's in at least 40 chiropractic centers around the United States, and I would definitely find an IDD. Just look it up. IDD centers on the internet, and you'll find one.
I also am going to add a little something to this. This is still fairly new to me, and I still have much to investigate personally. But the belt that I'm wearing right now, I had another belt that was elastic. Now, just a little quick background story. I am at about, well, actually exactly at 6 months after burst fracture of lumbar third. So basically I've got metal hooks, all sorts of stuff, very interesting x-ray picture of the lumbar spine. So the same question, because the way I want to make sure that my spine comes back into in its ideal working environment. So this is a very interesting belt, and I'll give certain feedback more, that gives, it doesn't flex. It provides guidance for the spine to form a certain way. And so I'll see what happens when I wear it, but so far it's been feeling pretty good. Uh-huh.
More happy anniversaries.
Thank you.
Let's see. Oh, here we go. What is the formula for nebulizing with hydrogen peroxide? How much with saline, or do you do it straight?
Okay.
How do you nebulize with hydrogen peroxide?
Quite simple. Hydrogen peroxide. Put the whole thing. Put the whole bottle. 3%. It comes at a pharmacy. 3%. Pour it in. No saline. Just keep it as it is, and go for it.
Inhale it. Simple.
Yeah. And you can do it again, and it's usually not a problem. But if the lungs become too sensitive, you may want to take a break. But you'll know. Yeah.
Okay. I have a question about eugesterone dosage for post-surgical removal of an ovarian cyst. The doctor recommended Vizan, sorry, a brand of progestin, and my friend suffered side effects.
Okay. Now, the trouble is when doctors recommend hormones and progesterone and all sorts of things, estrogens, you're dealing with synthetic horse-based hormones. And again, I'm not 100% blue. I'll have to look up the name, but if it's a synthetic or horse-based, I will absolutely not be surprised that there's going to be a problem. This is the thing. Eugesterone is meant to be...
You means true.
True to you, true to your body. That's how your body makes it, and that's how your body recognizes it. And so there's do you know of any problems or side effects that people told about?
I haven't heard any now. In fact, she had an ovarian cyst, however.
Mm-hmm.
And a person with ovarian cyst, I would think it could happen with any kind of manipulation of your hormones.
Possible.
But I would still try the eugesterone before I gave up on it.
Well, and the cysts are usually estrogen predominance. So balancing estrogen and progesterone may even be very helpful.
Yeah.
Worth a shot. I like that question. Anything to do with hormones, I really, really enjoy.
Do you suggest aspirins for the virus, it says?
According to information, yes. Yes.
And it says, the last one, it says, for a mid-30s menstruating woman, can you recommend a dosage schedule to prevent future cyst development?
Okay, if you're still menstruating, you do not use it during the menstrual period. You do it when the menstrual cycle, after 7 or 10 days or whenever it stops, then you use it until the start of the next cycle.
Okay. Very good. And that is it for the questions online.
Well, folks, it's been nice being with you this week. Have a good one.
Yep. I do want to finish up and just mention one more time. Please don't forget to put and we still got to give another 30 seconds to input your comments or just say hello, because anyone who enters their information or basically gets in touch with us, well, in the next 30 seconds, and whoever who already has is going to have, well, it's a grand prize. All our courses, including biogenics, pain management, life beyond 100, personal intuition. My God, that's just a wealth of information. And we look forward to hearing from you. And the message is, if you're watching us now, keep watching, because this year we're going to bring you more content, more information that's relevant to your health, to holism, to everything that relates to you as a human being. And next week is going to be amazing, as well as some very interesting deals and things that would like to announce. And the following week, maybe even a better promotion that we'd like to tell you. Something that, well, you just can't refuse.
Keep looking forward.
Keep looking forward and stay in touch with us.